Hello, everyone. My name is T.G.Miller, and today I'm sharing with you my Leadership Strength to Strategy plan. Today's healthcare system leader has an incredibly difficult job. The system is constantly changing with the increased demands for patient satisfaction, cost containment, and positive outcomes. The DNP prepared nurse is well equipped with their mixture of skills to take on this challenge and lead in areas of clinical scholarship, collaboration, change management, quality improvement, and policy development. As part of the Doctor of Nursing practice journey, I've come to explore the possibilities of my new role as a leader in the healthcare industry. And as part of this exploration, I completed a self-assessment of leadership skills and met with two advanced degree holding nurse leaders. Both of the projects provided insight into the qualities and characteristics of an effective leader and how to build on my own skills and look for opportunities for growth. I also explored leadership style and change model theory. We need forward-thinking, effective leadership if we're to be successful at improving the health and well-being of the U.S. population. The Association of Nurse Leaders, AONL, is a national professional organization. Their core vision focuses on the goal of transforming healthcare through expert and influential leadership. And among their many offerings, the AONL provides an opportunity to complete a leadership self-assessment. I completed a nurse leadership self-assessment in January. This self-assessment scored my skills across 5 different categories, including communication and relationship building, knowledge of the healthcare environment, leadership, professionalism, and business skills. The results identified areas of greatest strength as well as opportunities for development. So let's talk about the strengths first. The results of the AONL Leadership Self-Assessment revealed that my top 3 areas of strength were in the areas of foundational thinking, personal and professional accountability, and clinical practice knowledge. All 3 of these strengths are rooted in a background in critical and acute care, and with my experience in serving in the role of preceptor, charge nurse, and rapid response nurse. These strengths are reflected in the ability to think critically, create a trusting environment with our patients, and identify the educational needs of nursing staff. In addition, I demonstrate a commitment to practice with compliance, whether it's to my employer, the law, professional codes of conduct, best practice, or ethical standards. In addition to strengths, the self-assessment also identified areas and opportunities for development, and as expected, the greatest deficiencies were in executive skills, such as leadership, relationship building, especially with the community and business leaders, and the other skills that are related to business management and finance. These deficiencies are largely due to my lack of formal leadership role experience. Today's healthcare leaders must be able to adapt. The nurse leader that is able to inspire others and facilitate consensus building, participate in strategic planning and quality initiatives, and manage financial resources has all the pieces to be well equipped to represent nursing at every level of the healthcare delivery system. Expanding knowledge and working to develop skills is a personal investment in oneself. In order to do so, one must take advantage of opportunities to grow. DeWald and Reddy suggest seeking support and guidance from other leaders. This support and guidance can come from a current manager or professor, by seeking a mentor, or by networking through a professional organization. Other opportunities for skill development include serving on a unit council or committee, seeking additional certification, expanding on computer and technology skills, and welcoming feedback from peers. In my personal experience, I seek feedback or insights from my peers, orientees, and other members of the interdisciplinary team. I want to know what I can do better. I plan to expand my experience also by serving in Shared Governance Council on both the Education and Quality Improvement Committees, and eventually, I would like to lead a QI project for my unit. If I take a look at where I am today, and I set specific goals over an established time frame, I don't just wait for the opportunities, I create them. Part of the path of creating opportunities is seeking guidance from another leader. This opportunity was provided by conducting 2 interviews with advanced degree holding nurse leaders. I opted to speak to people that lead in 2 different areas, 2 different ways. One, a nurse executive with over 18 years experience in their current position is responsible for the overall accountability and daily operation of patient care delivery. He also provides oversight of the Patient Safety Council and is accountable for all operational and regulatory compliance areas. He also provides financial oversight with the operational budget. The other leader is a clinical nurse educator, and she is responsible for all of the educational classes and programs required to maintain competencies and standards of practice in all of the intensive care units. She's also the chair of the Evidence-Based Practice Committee, and she participates in ongoing research in clinical practice. She also serves on the policy review, quality, and safety committees. While one leader has many people reporting to them, the other doesn't have any, and yet they share many similarities. Their responsibilities are multifaceted, their involvement reaches well beyond their job description, and they both are crucial for the delivery of safe, quality patient care. Both have great impact through their actions, decisions, and behaviors. And while one oversees all the aspects of patient care services and sets the goals for management, the other makes sure that the staff is equipped to achieve them. One isn't successful without the other. Of the many insights offered by these interviews, 2 great lessons were learned, and the first is summed up by a quote from Donald McGannon: "Leadership is an action, not a position." Every person can lead, regardless of their title. And the other lesson is that every nurse is responsible for their professional development and their pursuit of continued learning. Both of the leaders interviewed modeled behaviors that are characteristic of a transformational leader. Both leaders are excellent communicators, champions of personal development, and motivate others to work to the best of their abilities. The transformational leader makes a commitment to creating a supportive work environment that inspires others to work towards a shared goal. Dedication to creating collaborative relationships has been shown to enhance work satisfaction, reduce turnover, and promote a healthy work environment, all of which tie into positive patient outcomes. The transformational leader inspires, empowers, and creates change. And these characteristics allow them to manage the challenges of working with people of varied educational background. This type of leadership is also able to take the 5 leadership strength categories of communication and relationship building, knowledge of the healthcare environment, leadership, professionalism, and business skills, and then create the means to empower others. An organization is more likely to achieve success when both leaders and employees can adapt and grow with change. The transformational leader is well suited to implement change, and they're willing to challenge practices when they don't match organizational values. Cost, clinical governance, quality, patient safety, and workforce dynamics are the forces that drive change in healthcare. The implementation of change within an organization requires buy-in among the stakeholders, and those stakeholders are the patients, providers, payers, and policymakers. While all the stakeholders may share a common goal, their interests, as well as barriers, may be different. For example, while everyone can agree that improved outcomes and quality of care are motivating factors, policymakers and administration may be more interested in direct and indirect cost. In contrast, the bedside nurse may be more concerned with the impact on workflow, and the provider may be concerned with the reimbursement schedule. Cotter's change model is an inclusive 8-step process that is well suited for the transformational leader. Cotter's change model begins with creating a sense of urgency, making a guiding team, identifying a vision, and then empowering others. This change model complements the transformational leader as its emphasis is on collaboration and a shared vision. Everyone benefits when an organization can adapt and grow with change. And the shift from volume-based care to value-based care further solidifies the importance of leadership at every level of the healthcare organization. The AONL leadership self-assessment, as well as the leadership interviews, confirm that a leader who can combine clinical expertise and leadership skills such as communication, emotional intelligence, and relationship building, as well as business acumen, is an essential presence at every level of healthcare delivery. As I continue to expand my knowledge and experience through this journey, I hope I too will join the ranks as an agent of change and healthcare redesign. Thank you so much for listening.